Hi guys, and welcome back to my channel. So today we're going to be covering a subject which a lot of patients find quite nerve-wracking. So it's going to be about what to expect if you're having a tooth extraction. So a lot of patients, quite understandably, are very nervous and afraid of their dental extraction. So in today's video, I'm aiming to explain what to expect during the procedure and a step-by-step account, and hopefully knowing what to expect will help reduce your fears and anxieties before your dental appointment. So what are some of the reasons that your dentist might have recommended you to have a tooth extraction? That can be tooth decay that has gone way too far into the nerve and the tooth is unsavable. It could be a tooth where the root canal treatment has failed. It could be also possible tooth involvement with gum disease. But whatever the reason is, the procedure is pretty much the same each time. So what will happen? You'll be going to your dentist. Hopefully you've had something to eat before your procedure begins, and your dentist will just make sure that you're feeling okay, that your general health is fine, and they'll proceed by giving you a small injection of local anesthetic where you'll feel a small sharp scratch, and that's usually the most painful part of the appointment. So within the next few minutes you will feel that part of your face and your mouth going numb. It's not your tooth that just goes numb, it will be also the gums and any soft tissues around your tooth as well. So the dentist will make sure that your tooth is obviously very numb before they begin. So any sharp pains that you have during the procedure should be gone. However, you will still feel some pushing and some pressure during the procedure. That's completely normal. So the dentist will use the tools to slowly loosen the teeth and hopefully extract it in one piece. Usually they will check afterwards to make sure that it's also stopped bleeding, and they will give you some post-operative care instructions to make sure that you look after your extraction site as best as possible. What kind of post-operative tooth extraction advice will they give you? Usually that includes things like just taking it easy for the rest of the day, having any painkillers to help with the pain. Usually they will recommend either paracetamol or ibuprofen. They'll also recommend that you be careful that you don't bite your lip, as you will still be numb for a few hours. So in terms of what other care advice they give, they'll advise you not to have anything very hot or very cold and sharp for the rest of the day, because they don't want the socket to start bleeding again. If your dentist has placed any stitches or sutures into the wound, they might be resorbable, or they might get you back in for a follow-up appointment to remove the stitches. So when you get home, you can expect a little bit of pain and a little bit of swelling where you've had the tooth extracted. Within the next few days, the pain should be getting less. If it's not getting any less and it's just getting worse, then usually you can make a follow-up appointment, and if you have any problems such as an infection, your dentist will be able to treat that accordingly. So hopefully with today's information I've helped to put your mind at rest, and the next time you go to a dentist and you might need an extraction, it will help reassure you. So thank you for tuning in, and if there are any other requests that you guys might have on topics that you want me to cover, please leave a comment below, and also don't forget to subscribe. Thank you.